say not to stitch, because every time you stick a suture in there and pull it out the other side, you now have 2 more holes that bacteria can get into. So it is important to know when not to stitch. When not to stitch. If it's dirty or contaminated with debris. If someone has fallen in the woods and kind of scraped themselves and they have a big open wound and it's full of leaves and dirt and all kinds of nasty stuff that you can't get out despite all of your washing and scrubbing, you're probably not going to want to close that up, because all of that debris is just a breeding ground for bacteria. So if you sutured the top layer and all of that stuff is still in that wound, you are going to get an infection. If it's already infected, somebody hurt themselves, you happen to be the medical person for that group, they come to you 2-3 days later and it's oozing and it's red and it's painful, don't close it up. Again, all you're doing is trapping the bacteria that's already starting to grow in there, and it's just going to get worse. So you cannot close up an already infected wound. If it's over 6 hours old, basically what we're saying is it's been exposed to bacteria, it wasn't closed up when it should have been closed up, and now the bacteria is breeding, so don't close it. If it's a large gaping wound, which is what we're looking at here, I mean, there's no way you're going to bring those 2 sides together, okay? If you have a chunk of skin that's been removed and the skin does not come together nice and easily just by light pushing, you are not going to close it. Because all you're going to be doing when you're putting those sutures in is pulling the skin, and those sutures are eventually just going to be eaten away, because that skin elasticity is just going to keep pulling on it. So if it doesn't come together nicely, don't close it. Okay, so when to close? If it's clean, obviously opposite. Not infected, there's no dead or burned tissue. Again, if you had burned yourself here while you got a cut, maybe some cauterization thing, that burned tissue inside and outside, if you close that up, you're just trapping dead tissue. Dead tissue is going to be eaten away by bacteria. You're going to get an infection, so don't close that. If it's very deep, you're going to need to close it. You're going to probably need to do deep wounds in 2 layers, and we teach that over in our suture class, because if you just close the top layer, you have dead space underneath, and that's a nice place for bacteria to grow. And over joints, if you have an injury, even if it's kind of small, and you've maybe tried a butterfly or a steri-strip to pull it together, but the first time the person went like this, the injury ripped back open, they need to put a suture in it. Generally speaking, if it's more than about, what'd you say, an inch over an elbow, an inch or more over a joint, you need to suture it, because it's just going to keep pulling open. Every time you move the joint, it's just going to keep ripping open and ripping open. And basically with the sutures, you're just trying to get the edges of the skin to meet so that your body naturally heals.